The microorganism that I'll be going over and I did my research on is the Streptococcus pneumoniae. And there are many things that goes on with this disease. When I was doing my research, it's not a problem. It's sometimes common, but not as common and as a problem as other diseases would be. The last specimens taken to identify if you have this certain disease is sputum and blood specimens, and they do urinary antigens to detect it as well. The symptoms you can have with this are cough, fever, shortness of breath, and chest pain. They can also do an x-ray on your chest to see if you have this, if it's gotten to where it's more of a risk in the patient. It depends if they have other underlying risk health issues or diseases. They can also do CT, but they don't recommend doing this CT as much because it's really high in radiation. The virulence factors of this disease would be the bacterial capsule, and this disease affects patients that are older than 65 years or older, patients that abuse alcohol, that smoke as well. They have chronic lung disease, patients that have cancer, diabetes, and any underlying heart diseases as well. The treatment for this disease would be antibiotic therapy. They would do antibiotics first, and they would rather start antibiotics as soon as possible, at least the first dose, so that the patient doesn't get severe if they do have other health conditions as well. The staining technique that they use for this is a gram stain. It is lancet shaped and usually gram positive. This is resistant to some penicillins as well, but they have other antibiotics they can use for the resistance. Also, patients who have COPD, it is more difficult for them if they have the disease as well. And for prevention of this disease, there's the pneumococcal vaccine that a lot of individuals get when they're younger. They start vaccines when they're babies, and they do recommend for you to get the vaccines to help prevent disease. Also, it would help if you did get it. It wouldn't be as severe as it would if a person who wasn't vaccinated as well. It more affects patients in lower income countries. Affects more, and is where this disease is more common than it would. When we were doing the research and we were seeing how much cases there was, when I did it, there was no cases of this at the week 24, which was good because it means it's not as common, and that's a good thing. And then it could be severe to some patients, but it's not as severe, and there are some things they can do to help prevent it and the treatment as well. Thank you.